Hello everyone, today we will write an update letter from the given case notes, and first I will go through the case notes. I will select the content which is relevant, which is important for that letter, and then I will write a letter. So let's start. When you start reading your case notes, start reading from writing task which is given at the end here. Writing task. Why writing task first is important? Because in writing task we have the information like which type of letter should we write and to whom we should write the letter, what is the purpose of this letter. So everything is given in writing task. So using the information in given case notes, write a letter to Dr. Bradbury, the doctor who referred Miss Garcia, to update her on patient status and follow-up treatment that may be required in the future. Address the letter to Dr. Loma Bradbury, Stillwater Medical Clinic, 12 Main Street, Stillwater. So we have the information like we need to write the letter to update her, Dr. Bradbury. We will update Dr. Bradbury regarding the patient's status because he referred the patient to us. We are treating the patient. Now we need to update her on patient status and follow-up treatment that may be required in the future. Then we have address. Dr. Loma Bradbury, Stillwater Medical Clinic, 12 Main Street, Stillwater. Next thing to read is notes, which is given the start. Notes. Assume today's date is 12 May 2015. You are a doctor working in Stillwater Hospital. Miss Garcia has remained admitted for the last 1 week, who was referred by her general practitioner, Dr. Bradbury. Dr. Bradbury is the general practitioner, the GP, to whom we are updating. So from here onward, I will only select the content which is relevant, which is important for this letter, and I will cross the information which is irrelevant, which is not important. So of course today's date is important. I will encircle it. And what else? Then in patient detail, patient name is important. Name is Isabel Garcia. Date of birth 1/1/1995. Address 29 Greenfield, Stillwater. So address is not important here actually. I will cross it. Then medical history. In medical history we have in 2017 fracture of right arm, then 2019 unexplained weight loss, possibility to stress, in 2014 difficulty sleeping. So this is past medical history, like a fracture in the right arm, unexplained weight loss in the past, and difficulty sleeping. They happen in the past, and GP knows all of this. So we will omit this. Cross. Then allergies, certain washing detergent cause skin irritation. Again, not important. Medication, doxylamine, PRN encouraged to not to use. Definitely not important. Family history: mother breast cancer, age 38, not important. Social history: student, second year, university student, second year, not important. Reason of referral: suspected meningitis. Yeah, this is important. We need to include this, that patient was referred with the suspicion of meningitis. Afterwards, we have treatment record. In treatment record, first date, the date on which patient was admitted is 23 May 2015. Second date given is 24 May, the very next day, and next date is 26 May, which is 2 days date here. This is 2 days date. Which is given on the tab as well. I'll show you now. Is here. It's 26 May. So, in treatment record, on 23 May 2015, patient presented with subjective, painful, stiff joint for 1 week, important. Sensitivity to light, important. Increased bruising, definitely important. Headache, neck stiffness, foot phobia, rash, important. Then on examination, what happened? We found that patient was afebrile. We can include this, but we can omit this. She was afebrile because this is not a significant finding. If patient was febrile, then it was significant. Bruising on the left arm, important. Petechial rash, abdomen and legs, important. Unable to touch chin to chest when lying spine, it's important. It's important sign of meningitis. Brudzinski's sign. It's difficult to pronounce actually. Brudzinski's sign. So then test ordered. We ordered these tests, FBC, RFTs. You can omit that because definitely we are going to write reports of these tests immediately after that. So you can omit this. Although important, but as we are writing the investigation reports, so we can omit this, that we ordered the tests. So results show white cell count, 14,000, CRP 150, which is showing that there is infection. So lumbar puncture was ordered, and patient was commenced on ceftriaxone 2 gram IVPD while awaiting lumbar puncture culture results. Dexamethasone 10 mg IV before first dose of antibiotic, then 10 mg IV every 6 hourly for 4 days. We will write the medications, but we don't need to write in that much detail because you will see later on the medication was changed. We'll include this, but we will summarize it. These medications were actually started before lumbar puncture reports. So now we have on the next day, on very next day, which is 24 May 15, patient symptom persisted. We can include that, we can omit that, symptom persisted. Yeah, same symptom. Then lumbar puncture report. Lumbar puncture report, white cell count is 1000. Polymorphonuclear, there is polymorphonuclear predominance showing bacterial meningitis. Then glucose 10, which is reduced, protein 70, which is elevated. So we will include LP reports, but we will write a summary of it. We can simply write that her lumbar puncture was suggestive of bacterial meningitis. So in order to confirm which bacteria is causing, we ordered microscopy and culture is given later on here. So the diagnosis on the basis of LP is bacterial meningitis. And then following lumbar puncture report, results benzalpenicillin 1.8 gram IV every 4 hours for 5 days was started. So this is the recent medication. We'll include all of it, like its dose, frequency, duration, everything. I'm talking about benzalpenicillin because it was started after lumbar puncture report, which showed that there is bacterial meningitis. Then nursing care. With regard to nursing care, patient was isolation. Then assess neurological signs. Patient was assessed for neurological sign, like seizure or whatever. Then monitor and care for the bruises to prevent complications. Yes, monitoring. So whenever a patient is admitted in hospital, nursing care is important. We include it. We'll include the nursing care. Whenever we are discharging a patient from the hospital, when we are updating patient's family physician regarding patient's condition in an update letter, like in this one. So we need to include nursing care. Then 26 May 2015, which is today's date here, microscopy and culture showed Neisseria meningitis. Patient responding well to the treatment. Which treatment? Benzalpenicillin that we have started after LP reports. This is important. Department of Human Services notified. Also important. Discussed with family regarding ensure family immunized. Important. Then our plan. We have planned to write a letter to the GP and recommend. So we are writing this letter. We will request the GP that you should contact close family and friends of the patient and ask them to seek medical attention as soon as possible. Observation for any signs of unexplained illness required. We will write it. Definitely we will paraphrase it. Then last one, question mark, mean possible, probable, if needed. Possible chemoprophylaxis for patient in recent close contact with the patient. Then writing task, we have gone through the writing task. So now we have selected the content, and from this content we can write a letter. So let's start. First thing to write is address. So here address is Dr. Luma Broadbury, Stillwater Medical Clinic, 12 Main Street, Stillwater. So first thing is address. So keep in mind, when we are writing the address, we should omit all the commas. The commas which are given here, they should be omitted, and each part after comma should be in the next line that we have discussed earlier as well. So address. Actually I will not type here because typing takes a long time, so I have typed it earlier. Now I will just paste it. So first thing is address. So you can see the same address which is given here, we have written the address, but there are no commas. We have omitted commas here. After address is today's date. So today's date is given here. I will highlight whatever I'm writing with yellow first. So this is 26 May 2015, today's date, which is also given on the top here. Okay. After that, is today's date. Then greetings. In greetings we will write dear doctor, then doctor's second name. Here doctor's name is Luma Broadbury. So we will write dear Dr. Bradbury. After greetings, next thing to write is RE line. RE mean regarding, in reference to. So we're writing this letter regarding Miss Garcia. So we'll write RE Miss Garcia, Miss Isabel Garcia, and her date of birth. Like this, name and date of birth. Before I write the letter, I will discuss its structure. Structure of an update letter is exactly similar to a discharge letter. Okay, so let's start. Definitely, first thing is introduction. Like every letter, introduction is the first. Immediately after introduction, we'll write the complaint with which patient was admitted. Here the patient was admitted in the hospital. So presenting complaint. The complaint with which patient was admitted on admission. So then hospital stay details. Which include nursing management as well. After that, patient's current condition. Current status, that either patient's condition is improving or not. Then any recommendation, any devices, whatever, any advice or recommendation. Then conclusion. So this is the order. Class introduction, then present the complaint with which patient was admitted. Then once we admitted the patient, what happened during hospital stay, examination, investigation, then diagnosis, then treatment. Like in the meantime, we also provided the patient with nursing management. So we'll also mention nursing management. After that, current status of the patient. Then if we have any advice, okay, or any recommendation, we will write that. Then in the end, conclude. So let's start. First thing is introduction. So here from the case note, now we know that we are updating patient's DP. Patient has been diagnosed with bacterial meningitis, like Neisseria meningitis, and patient was referred with suspicion of meningitis. So we will start. I'm writing to update you regarding your patient, Miss Isabel Garcia, who was referred with suspected meningitis, and she is receiving treatment and making good progress. And another way to write introduction of the update letter, like your patient, Miss Isabel Garcia, who was referred with suspected meningitis, is now being treated and making good progress. So this your patient thing, we can write this in discharge and update letter only, because in both these cases we are not referring actually, and in case of discharge we are discharging the patient to primary care physician, and in case of update letter we are updating patient's primary care physician. You can write your patient only if we are sending the patient or writing the letter to patient's primary care physician. So your patient, Miss Garcia, our full name is Isabel Garcia, who was referred with suspected meningitis, is being treated and making good progress. After that, we'll write the complaint with which patient was admitted. You can see here treatment in the treatment record. On 23 May, when patient was admitted for first time. So subjective, we have here painful stiff joints for 1 week, sensitive to light, increased bruising, headache, neck stiffness, photophobia, rash, and on examination, patient was afebrile. We won't write that. Then bruising on the left arm, tickle rash, abdomen and legs, unable to touch chin to the chest when lying supine. So we'll write all of them. In case of speaking, we will break down medical terms into layman. In case of writing, we will write layman terms into medical terminology. Okay, here we have sensitivity to light, which means photophobia. So it would be better if we use medical terms here because we are writing to another healthcare professional. So we can write photophobia instead of sensitivity to light here. We can write photophobia, which is given here. Another thing is unable to touch the chin to the chest. This one, last one here. So it's Brudzinski's sign. Brudzinski's sign. So we can use medical terminology. Instead, we should use medical terminology here because we are writing to another healthcare professional. So on admission, Miss Garcia had headache. Okay, we have it's given here headache. What else? Neck stiffness. Okay, and photophobia and rash. Okay, and what else? There was painful and stiff joints, and there was increased bruising, but we can include bruising in examination part as well, as given below here as well. Bruising in the left arm, whatever. So we can include bruising part in the examination part. So let's start. On examination, Miss Garcia had a headache, neck stiffness, photophobia, painful and stiff joints. On examination, what we found? We found there were bruises on the left arm and there were petechial rashes. It's given here. Bruises in the left arm and petechial rash on the abdomen and legs. So on examination, there were bruises on the left arm and petechial rash on the abdomen and legs. On admission, Miss Garcia had a headache, neck stiffness, photophobia, and painful and stiff joints. On examination, there were bruises on the left arm and petechial rash on the abdomen and legs. Next thing is that this unable to touch chin to the chest when lying spine, this Brudzinski sign. This is we need to write this one as well. So we'll write additionally Brudzinski's sign was positive. Additionally, Brudzinski's sign was positive. So next thing is test ordered. It's very big list, full blood count, renal function tests, liver function tests, CRP. Okay. We don't need to write all of them. You can simply write relevant investigations were ordered. Relevant investigations were ordered. And next we will write investigation reports, which are given here in under the heading of result. Here results. So we have this white cell count 14,000, CRP is 150, and lumbar puncture was requested, and ceftriaxone as well as dexamethasone were commenced. Will not write the details of these medications. Why? Because after lumbar puncture report we are changing the medication. It's given here, you can see lumbar puncture report. Then we started the patient on benzyl penicillin, which is given here. So we don't need to write the details because patient is no more on ceftriaxone. It has been changed. So next thing, investigation reports. So we'll write her investigation reports showed an elevated white cell count of 14,000 and CRP of 150. Therefore, she was commenced on ceftriaxone and dexamethasone. So we can write this in the same paragraph. We can change the paragraph as well. Okay. So let's right here. I think that's fine. Investigations showed an elevated white cell count of 14,000 and CRP of 150. Therefore, she was commenced on ceftriaxone and dexamethasone. Then, on the next paragraph, we can change the paragraph here. On the next paragraph, we will write LP reports. Okay, and after LP reports, we change the medication. So we will make a next paragraph, new paragraph for them. So next date is 24 May. On 24 May, symptom persisted. LP report showed white cell count were raised with polymorphonuclear predominance. Then glucose was reduced and protein was elevated. All of these findings were suggestive of bacterial meningitis. So we don't need to write all the findings. We will simply write that patient's lumbar puncture report was suggestive of bacterial meningitis. Then after that, we write a summary of it. Then after that, we will definitely request this microscopy and culture, and we commence the patient on benzyl penicillin. So the paragraph is Miss Garcia's lumbar puncture report was suggestive of bacterial meningitis. Therefore, she was switched to benzyl penicillin. We are switching the medication. It's important to mention that she was switched to. If we write add, benzyl penicillin was added, it will show that in addition to ceftriaxone, benzyl penicillin was added. So we will here categorically write that she was switched to benzyl penicillin. Ms. Garcia's lumbar puncture report was suggestive of bacterial meningitis. Therefore, she was switched to benzyl penicillin 1.8 gram IV 4 hourly for 5 days. We can write IV instead of intravenous. That's fine. Then microscopy and culture thing. We can write it here or we can leave it for now. What else? We have this nursing care now. Nursing care includes isolation, because in case of meningitis we need to isolate the patient, and assessing for neurological signs, monitoring for bruises to prevent complications such as DIC. So we will write all of them. So with regard to isolation, with regard to nursing care, she was kept isolated and assessed for neurological signs, as well as monitored for complications such as DIC, or disseminated intravascular coagulation. With regard to nursing care, she was kept isolated, assessed for neurological signs, and monitored for disseminated intravascular coagulation. Then next paragraph. In next paragraph, we will write microscopy and culture reports, and we will write patient's current status, which is given here. Microscopy culture report, and which was actually, which is today's date actually, 26 May. 26 May microscopy culture report showed Neisseria meningitis, and patient is responding well actually, and we have notified Department of Human Services and discussed family with regarding immunization, family immunization. So, and today, here we write today, because today's visit. This is today. So today, Miss Garcia's microscopy and culture has confirmed Neisseria meningitis as the causative organism. So, N of Neisseria will be capitalized here, as Neisseria is a name, genus name here. Today, Miss Garcia's microscopy and culture has confirmed Neisseria meningitis as the causative organism. She is responding well to the treatment. So, it is not important to write a separate paragraph for everything. It's not important at all, but the flow of information, the order of information should be like this. Okay? As this is how naturally it happens when you admit a patient. Okay, so today, Ms. Garcia's microscopy and culture has confirmed Neisseria meningitis as the causative organism. She is responding well to the treatment. The Department of Human Services has been notified. Her family has been consulted about immunization. It's given here, like discuss family regarding immunization. Then in the end, we will conclude our letter. In the conclusion, we normally expand our purpose. Here we will expand our purpose as well. So here purpose of our letter is to update the GP. So we are updating the GP. Throughout the letter, we have updated the GP regarding patient's condition. Now we have some additional purposes, which includes, like, we will ask the GP, which is given here. You can see contact letter to GP, contact close family and friends of the patient. This is what GP should do. We will contact the GP. We will ask the GP to contact close friends and family of the patient, because this is something which should be done by the GP, not by the hospital doctors. So contact them and ask them to seek medical attention immediately, as soon as possible, if they observe any signs of unexplained illness. And also we will recommend the GP to provide chemoprophylaxis for the patient who remained in close contact with the patient recently. So in conclusion, we'll write conclusion like this. Let me show you. You are requested to contact family and friends of Miss Garcia. It should be Miss Garcia. MS. Miss Garcia, and advise them to seek immediate medical attention in case of any signs of unexplained illness and to provide chemoprophylaxis to the recent close contact with her. After that, now we will sign off our letter. Like yours sincerely and Doctor. Yours sincerely and Doctor. Let's go through the letter for the last time. Dr. Luma Broadberry, Stillwater Medical Clinic, 12 Main Street, Stillwater, 26 May 2015. Dear Dr. Bradbury, regarding Miss Isabel Garcia, date of birth 0101 1995. Your patient, Miss Garcia, who was referred with suspected meningitis, is now being treated and making good progress. On admission, Miss Garcia had a headache, neck stiffness, photophobia, and painful and stiff joints. On examination, there were bruises on the left arm and a particular rash on the abdomen and legs. Additionally, Brzezinski's sign was positive. Relevant investigations were ordered. Her investigation showed an elevated white cell count of 14,000 and CRP of 150. Therefore, she was commenced on ceftriaxone and dexamethasone. Next paragraph. Miss Garcia's lumbar puncture report was suggestive of bacterial meningitis. Therefore, she was switched to benzyl penicillin 1.8 gram IV 4 hourly for 5 days. With regard to nursing care, she was kept isolated, assessed for neurological signs, and needed for disseminated intravascular coagulation. Today's paragraph. Today, Ms. Garcia's microscopy and culture has confirmed Nazirum meningitis as the causative organism. She is responding well to the treatment. The Department of Human Services has been notified. Our family has been counseled about immunization. You are requested to contact family and friends of Ms. Garcia and advise them to seek immediate medical attention in case of any signs of unexplained illness and to provide chemoprophylaxis to the recent close contacts with her. Yours sincerely, Doctor.